Okay, so about up until around 4 or 5 years ago, I was like probably most people and practitioners, and I was thinking that melatonin was a sleeping aid, and that's what it did. You took melatonin, put you to sleep, and that's what we're using it for. And then I was researching the literature, and I came upon a study by Russell Ryder, who was probably later I learned the foremost living authority on the use of melatonin, at least in animal research, of which there's mostly only animal research, by the way, not a lot of human research in this. But there's a ton of animal research. And I came upon an article with Dr. Ryder had published about using melatonin in animals that had breast cancer. And what he was able to do is he developed a technique whereby you can measure the rate at which cancers multiply or get bigger. And what he noticed was that during the nighttime, the cancer doubling rate cut almost down to 0. And that during the daytime, it went right up to normal again. And so he did just, being a melatonin researcher, this probably has something to do with melatonin. So he started giving this melatonin during the day as well. And what he noticed, and what the study was published about, was that the growth rate of cancer just stopped. Every time he gave the melatonin, the growth rate of cancer stopped, went to null. When he took it away, it started right up again. He also noticed it didn't make him sleepy. They had normal levels of activity. And so a couple of interesting things about melatonin that I learned later, after reading this article, I gave Dr. Russell a call, and we talked on the phone for about an hour and a half, and subsequently to that, I've done on a number of occasions. And this is absolutely well for you. You're a great speaker for your guys, by the way, Russell later. And he explained to me all kinds of other physiological effects of melatonin. It is a premier anti-cancer remedy. We talked a little bit this morning about oral carcinomas, and I have melatonin can now preventive treatment.
Ready to film from
but in animal settings, at least, this is what it prevents. In animal settings, every single cancer test, cardiovascular disease, Alzheimer's, Parkinson's, diabetes, and macular degeneration. I'm going to tell you that's like most of the stuff that you need to be concerned about. So it's absolutely amazing substance that goes far beyond what we typically think of when we think of melatonin as a sleeping aid. So let's just take a look at what we got so far. I'm just going to start with some melatonin facts, and then we'll get into the dentistry. Melatonin is secreted by multiple organs, not just the pineal gland. To explain the situation to you, melatonin in the brain is produced in the pineal gland. That release and production of melatonin is stopped or halted by light. So when light comes into my eyes, my pineal gland stops releasing melatonin into my brain. When light goes away, assuming it goes away, because it doesn't always go away in this 24-hour society of ours, a lot of times there's lights on all the time. And it just takes a little bit of light to stop the production of melatonin. But as soon as darkness ensues, and there's no more light to inhibit that, the pineal gland produces and releases melatonin. And melatonin accentuates the impact of darkness. So what's interesting is melatonin doesn't put us to sleep. Darkness puts us to sleep. Melatonin sensitizes us to that effect of darkness.
Well, okay, that's fine.
And that's kind of important thing to do. As you will see, you can give melatonin around the clock to people when they don't get sleepy. It's not a stopper.
Transfer.
But it's also produced in the retina, which explains probably why it has such an impact on macular degeneration. It's produced in the bone marrow. A huge amount of melatonin produced in the gastrointestinal tract. And melatonin in medicine has a lot of applications in gastrointestinal medicine, particularly gastritis and reflux disease. And also in the immune system. It's a major immune system stimulant. And in the pineal gland, its major function, of course, is regulation of circadian rhythm, the dark night cycle. Darkness makes us want to sleep. Light makes us not want to sleep. Melatonin regulates that. In the absence of melatonin, you don't get sleepy when it gets dark. You might get sleepy when it gets light. You don't have any regulation to what's going on. And this is kind of the problem when you have jet lag, right? Because in jet lag, the darkness lightness thing goes off. And you need a little extra melatonin. You don't normally have your dosage. Just desensitize you, which you use the new cycle. It also plays an anti-inflammatory, an anti-cancer, and an immunomodulatory role in scavenging free radicals. It's the most potent central nervous system free radical scavenger there is. And it is, for that reason alone, probably the single most potent nutrient you can take to prevent neurodegenerative disease. It works via interactions also with cell membranes. There's two membrane receptors that have been identified, MT1 and MT2, and in intracellular protein metabolism. Melatonin also enters the oral cavity through the saliva. So this has applications dentally in as much as a melatonin mouthwash, or just taking a little melatonin powder, put it in your mouth, swish it around. Melatonin's bound to albumin. So the amount of melatonin in the saliva is roughly, since there's less albumin, roughly about a third of what's in the bloodstream. So one good way to get melatonin in the saliva is to have a whole bunch of it in the bloodstream. Take a melatonin pill. Okay, since most melatonin is bound to albumin, the amount of melatonin in saliva is about 1/3 of that in blood. Melatonin exerts antioxidant effects, both directly, incidentally, and also by interacting with its receptor sites. So it has receptor sites, MT1 and MT2, on cells throughout the body, particularly immune cells and nerve cells. Since there are MT1 receptors on healthy and cancerous oral mucosal cells, melatonin may act as an anti-inflammatory or an anti-cancer agent in the oral cavity, and we'll be talking about this. Anti-inflammatory effects of melatonin have also been reported on human gingival fibroblasts, so we'll talk a little bit about gingivitis and periodontitis. Intraperitoneal melatonin has been shown to reduce periodontitis in diabetic rats. That's important because diabetics are about 3 times more likely to get periodontal disease than the average population. Melatonin affects that. Topical application of melatonin in diabetic patients decreases periodontal bone loss by downregulating pro-inflammatory factors. I'll show you some really fascinating studies about how all that bone loss that we've come to expect, not only dental bone loss, but skeletal bone loss, that we've come to expect as an age-related phenomenon, can be completely prevented with melatonin. There is good evidence that melatonin can be used in the management of periodontitis and oral cancer. Okay, so we'll talk first of all about melatonin for the treatment of periodontitis. This article is a good review article just entitled Periodontal Diseases. And in there they talk about all kinds of things, specifically mentioning that there are genetic, dermatological, hematological, granulomatous, and immunosuppressive and neoplastic disorders that have periodontal manifestations. So as I'm sure you guys know, periodontitis is serious systemically. And all medical practitioners should make it a routine habit to look at the gums. And I pretty much look at the gums of all my patients that come in, especially the sick ones. And if I see good, healthy gums, I can almost guarantee you there's nothing wrong with that patient of any consequence. And if I see bad gums, there's going to be problems. There's probably going to be diabetes or some other degenerative disease that I'm dealing with. So this periodontal issue, just to clear that up, can have a big effect on medical conditions, a wide range of medical conditions. Common forms of periodontal disease have been associated with adverse pregnancy outcomes, miscarriages, cardiovascular disease, as you know, that's well published, strokes, pulmonary disease, and of course diabetes. Prevention and treatment are aimed at controlling the bacterial biofilm and other risk factors. So how do you deal with this? You control the bacterial biofilm, that's your dental hygiene. You arrest the progressive disease, so whatever the disease is, you deal with that. If it's diabetes, you deal with that. And restoring lost bone tooth support. So if there's been bone loss, you do what you can to restore that bone loss. And remember that, because we're going to show you a study a little bit later that shows melatonin actually improves a lost bone. More from that same article, the periodontal diseases are highly prevalent and can affect up to 90% of the worldwide population. Gingivitis, the mildest form of periodontal disease, is caused by the bacterial biofilm that accumulates on teeth. And periodontitis results in loss of connective tissue and bone support, and is the major reason people lose teeth as they get older. So this article is entitled Multi-Organ Injuries Caused by Liposaccharide-Induced Periodontal Inflammation in Rats and How Melatonin Plays a Role. So they took some rats, and they had the control group. They had another group that they put the lipopolysaccharides on the gums, applied them topically, which creates an inflammation and irritations that produces a periodontal inflammation. And at the same time, within the third group, they did the topical lipopolysaccharide, and at the same time give them some oral melatonin. So in the melatonin group, they were given 50 milligrams of melatonin per kg. Now notice the dose. 50 milligrams per kg of melatonin. For a human being, that's coming close to 70 times 50. So I think that's something like, not being a genius, 3,500 milligrams a day of melatonin. Whopping dose. And I make the particular mention of this because there's a lot of quote experts out there on melatonin who warn us all, be very careful of melatonin. It could have disastrous effects. Be very careful you don't get too high a dose. It could affect autoimmunity, or it could do this, or it could do that. All theoretical, absolutely zero. Nothing is proven on this. There's never been found a toxic dose of melatonin. They're giving these rats the equivalent of you and I taking 3,500 milligrams a day, and nothing happens to them except they get better. And so they apply that on the day of, and for 10 days after the lipopolysaccharide application. Interestingly, liver enzymes go up. Periodontal disease causes elevated liver. It compromises liver function. It compromises kidney function. The BUN goes up. And all of that was attenuated in the group that received the melatonin. The researchers concluded the results revealed that increased serum AST, ALT, and BUN levels following periodontitis are ameliorated with melatonin treatment. Notice the dose has to be kind of high, however. Okay, this study is called Therapeutic Effects of Melatonin. By the way, if you go to PubMed and you plug in melatonin in dental applications, get ready, because you're going to have like 240 studies pop up. So I'm just picking from a few here. There's just an unbelievable amount of work done on this topic. This one's called Therapeutic Effects of Melatonin on Alveolar Bone Resorption. Big problem after experimental periodontitis in rats. So rats were divided into three groups. You had your control. In this case, they induced the periodontitis with a ligation type of procedure. And then they had the induced periodontitis melatonin group. So those are the three groups. For the periodontitis induction, the first molars were ligated submarginally for 4 weeks. And then the rats were given either melatonin or they weren't given melatonin. In this case, they were given 10 milligrams per kg, or roughly 700 milligrams a day in human equivalents, for 2 weeks. The alveolar bone resorption and myeloperoxidase activity, which is a measurement, by the way, that we use in medicine for cardiovascular disease, is myeloperoxidase activity, were higher in the periodontal group as opposed to the one that got the melatonin. Osteoclast activity was significantly lower in the group getting melatonin. As you'll see, melatonin has an anti-osteoclast action to it. And they concluded the study reveals that melatonin treatment significantly inhibits regional alveolar bone resorption and contributes to periodontal healing in an experimental model. This one's called The Effect of Melatonin on Bone Loss, Diabetic Control and Apoptosis in Rats with Diabetes with Ligature-Induced Periodontitis. So they took a whole bunch of rats and they induced diabetes in them with a drug called streptozocin. And then in some of them they ligated and produced the periodontitis, and in others they did that as well as given melatonin at a dose of 10 milligrams per kg per day for 4 weeks in the study. Notice that melatonin significantly decreased osteoclast numbers. And the authors state within the limits of the study can be concluded that systemic melatonin treatment can decrease osteoclastic activity and reduce alveolar bone loss in the model using rats. And this is rats with diabetes mellitus. So your patients that have diabetes that you're seeing and you're battling this problem with them, you now have a new weapon in your quiver that can make a huge amount of difference. Periodontitis and diabetes, a two-way relationship. This particular article points out that severe periodontitis affects anywhere from 10 to 15% of adults. These are the severe cases, and that's about what I see in my sick people that come in my office. Risk for periodontitis is increased to threefold in diabetics. And the mechanisms include, diabetics with the hyperglycemia have defects in their immune system functioning. The neutrophils don't quite work so well. They don't produce cytokines in an efficient manner, so they're more or less a setup for getting any infection of any kind, especially oral infections. And it's kind of a two-way street, because diabetes increases the chance of getting periodontitis. And when you get periodontitis, it decreases diabetic control, so it's kind of a little vicious cycle you can get stuck in. Some of the complications of diabetes are what? Neurological symptoms such as neuropathy. Oh, melatonin can fix that. The other one is blindness. Oh, yeah, melatonin has receptors on the retina. And the third one is end-stage kidney disease. Oh, melatonin has receptors in the kidney. In this particular model, end-stage renal disease is increased threefold, especially in diabetics with with severe periodontitis. The risk of coronary heart disease and diabetic neuropathy combined is 300% higher in diabetics if they have severe periodontitis. And they conclude that oral and periodontal health should be promoted as integral components of diabetes management. This study is entitled Therapeutic Potential of Melatonin in Oral Medicine and Periodontology. This is a great review article. It's got lots of good stuff and references in here. Melatonin decreases pro-inflammatory factors such as C-reactive protein, which may be the single most important blood test you could ever have. C-reactive protein, interleukin-6, and tumor necrosis factor alpha. It also downregulates activators of nuclear factor kappa B, NF-kappa B. Now, if you know anything about cancer, you know all that stuff is predominant in say, stage 3, 4 type cancer cases. In more severe cancer cases, they all have elevated C-reactive proteins, elevated IL-6, elevated TNF-alpha, and these are problems, and they thrive on NF-kappa beta. Melatonin decreases all of that, and it reduces periodontal inflammation while it's at it. In addition to upregulation of salivary acid phosphatase, alkaline phosphatase, osteopontin, and osteocalcin, it results in significant improvements in gingival index and pocket depth. Take some melatonin, start rubbing it on the gums, along with ozone. By the way, for those of you that are familiar with ozone and what it can do to gums, when you look at the studies that show it, they're identical. In fact, the effects of melatonin across the board are so similar to what I see with ozone therapy that it's just amazing. But you can take these and put a little ozone oil on the gums, apply a little topical melatonin on the gums, and pocket depths go away. And pretty simple, 2 weeks, takes about 2 weeks. These facts are indicative of enhanced osteoblastic differentiation and bone formation following the topical administration of melatonin. So well, let's talk a little bit about melatonin and osteointegration of the dental implants. Outcomes of topical applications of melatonin in implant dentistry. This is also a great article, a lot of good stuff in here. I'll just read a bunch of quotes from this article. Due to its antioxidant properties and its ability to detoxify free radicals, melatonin may interfere in the function of osteoclasts and thereby inhibit bone resorption. This inhibition of bone resorption may be enhanced by a reaction of indolamine in osteoclastic genesis, and this can contribute to certain benefits in implantology. So we pretty much know the mechanisms by which this happens, but it's an anti-osteoclastic therapy. The systematic literature review on the use of melatonin in implant dentistry aims at providing guidelines for clinicians. What they did is they looked at published PubMed articles between 1999 and 2013 that looked at melatonin use in implant dentistry. They go on to say melatonin, which is released into the saliva, has important implications in the oral cavity. To achieve dental implant stability, osseointegration involves a cascade of protein and cell apposition, vascular invasion, bone formation, and maturation. This process can be accelerated by local delivery of growth-promoting factors such as occurs with topical application of melatonin over the implant surface. Experimental evidence suggests that topical applications of melatonin may be useful in oral surgery and implant dentistry, increasing bone to implant contact values and new bone formation, and also improving the success and long-term survival of implant treatments. And you don't have to be a genius to do this. You could take a little melatonin powder, which you can get from purebulk.com. I've got nothing to do with them. It's purebulk.com. You can buy pure melatonin, unadulterated powder, and you take anywhere. The studies are taking anywhere from 1 milligram to, say, 3, maybe 5 milligrams in some studies, mixing it with a little saline or saliva for that matter, and just dropping it wherever you want to put it. Dropping it into the implant whole surface that you're using. They go on to say dental implants require surface modifications in order to increase their bioactivity prior to the placement into the periodontal bone. And there are several drawbacks of the kind of surface modifications that are used in this process, such as delamination and bioactive coating and ion leakage and particle residues. Melatonin has the potential to act as a viable alternative to unstable implant coatings. It's been observed that calcium illuminate scaffolds containing melatonin and platelet-rich plasma have a proliferative effect on human osteoblasts. So if you're using PRP, and I hope you are, in these instances, throw a little melatonin in there. This is an article that talks about melatonin stimulates osteointegration of dental implants. So in this case, they took beagles, they removed the mandible, and then they went ahead and put an implant in there. And they used an implant of 3.25 millimeters in diameter, 10 mm in length. Implants were randomly assigned to the mesial and distal sides on each side of the mandible, but prior to implanting, they took 1.2 milligrams of lyophilized powdered melatonin, which you can get commercially at least from one company in Switzerland, and maybe some companies here in the US, I don't know. Or you can make it yourself. And some of the other studies, they did not lyophilize it. It was applied to the bone hole at each side of the mandible. None was applied at control sites. Within 2 weeks, the melatonin has significantly increased the perimeter of bone that was in direct contact with the treated implants. New bone formation and interthread bone in comparison with the controls. They concluded topical application of melatonin may act as a biomimetic agent in the placement of endoosseous dental implants. There's another one, same people, more beagles. In this case, the implant gaps were filled with 5 milligrams of lyophilized powdered melatonin, along with porcine bone or collagenized porcine bone alone. So in this case, they're mixing it with bone. In 4 weeks, the melatonin plus porcine bone significantly increased the perimeter of bone that was in direct contact with the treated implants. Bone density and new bone formation in comparison with porcine bone alone around the implants. And they concluded once again, melatonin combined with porcine bone on implants reveals more bone implant contact at 12 weeks compared with porcine bone alone. This is another article, 2012 article entitled Topical Application of Melatonin and Growth Hormone. So they're going to mix the two together now for obvious reasons. Once again, to make sure that these implants take and they don't fail. So they took some growth hormone and melatonin, they noticed belong to the group of growth factors. These substances have been promoted to improve and accelerate osseous healing using topical applications. They used 4 IUs of recombinant human growth hormone and 1.2 milligrams of the lyophilized powdered melatonin, mixed them together, dropped them in the hole. Bone implant contact, peri-implant bone area, and interthread bone area were significantly higher in that group. And they concluded the present study confirms that growth hormone and melatonin synergistically enhance new bone formation around titanium implants in the early stages of healing. Okay, this one is just last year. Clinical and radiographic evaluation of immediate loaded dental implants with local application of melatonin. What they did is now they're taking patients. So they took 14 people with missing maxillary premolars. And they were randomized to receive 14 implants of a one-piece type that were subjected to immediate loading after 2 weeks of initial placement. Group 1 included 7 implants with acid-etched surface, while Group 2 included 7 implants with acid-etched surface combined with local application of melatonin gel at the osteotomy site. Patients were recalled for follow-up of 1, 3, 6, and 12 months after loading. All implants were considered successful after 12 months of follow-up. The authors discovered that 1 and 3 months there was significant differences in the marginal bone levels between the two groups. These results suggest that the local application of melatonin at the osteotomy site is associated with good stability and minimal bone resorption. I don't think there's much to lose by throwing a little melatonin in those holes. Okay, next up, melatonin for countering the cytotoxicity of drugs and dental materials. It's no surprise to you guys that you guys use some pretty toxic stuff. But it was a little surprising to me when I was going through this. So, for example, chlorhexidine. I didn't know that chlorhexidine was as potentially toxic as it is. So this article is a 2014 article entitled Melatonin as a Candidate Therapeutic Drug for Protecting Bone Cells from Chlorhexidine-Induced Damage. So standard adjuvant antiseptics, namely chlorhexidine, proved damaging for osteoblasts. Not good. That's not what we were looking for. Osteoblast morphology was evaluated. Total reactive oxygen species, ROS, and superoxide levels were quantified. Ratios of apoptotic and necrotic cells were identified by flow cytometry. Metabolic activity of remaining cells was assessed following administration of various concentrations of chlorhexidine in the absence or presence of melatonin. Chlorhexidine led to poor morphology, increased the total reactive oxygen species and superoxide levels, and their word is rigorously diminished the number of vital and metabolic active osteoblasts in a concentration-dependent manner. The more chlorhexidine you put in there, the more osteoblasts you knocked off. However, simultaneous melatonin supported cell morphogenesis and growth, basically obviated the toxicity of the chlorhexidine. These data reveal that melatonin protects osteoblasts in the chlorhexidine context, thereby implicating melatonin as a promising drug in periodontitis and peri-implantitis treatment. Bisphosphonates, some of my least favorite drugs, and I'm sure you guys, some of your least favorite drugs too. You probably don't like much seeing a patient come in to see you with needs an implant or some kind of dental surgery who's on a bisphosphonate. Turns out melatonin can help you there. This article is entitled Cytoprotective Effect of Melatonin on Zoledronic Acid-Treated Human Mesenchymal Stem Cells in Vitro. So it's an in vitro experiment using Zoladex, which is a very common bisphosphonate that we use. Periodontal ligament stem cells and bone marrow mesenchymal stem cells were exposed to zoledronic acid, melatonin, or zoledronic acid and melatonin for a whole 72 hours. Melatonin completely protected all these stem cells from the activity of the bisphosphonate and significantly increased their proliferation. They not only did not die from this, which is what they normally do, they actually proliferated. The authors go on to say these results suggest that melatonin has a cytoprotective effect on zoledronic acid-treated stem cells, and thus could be used for bisphosphonated-related osteonecrosis of the jaw, bronze syndrome. Therefore, topical application of melatonin prior to dental surgery may prevent bisphosphonated-related osteonecrosis of the jaws. Every one of my patients now for 3 years who's getting any kind of bisphosphonate, and I don't hardly ever use it, but sometimes for cancer reasons you sort of need it, as it gets melatonin in really high doses. My standard cancer patients are on 240 to 500 milligrams of melatonin spread throughout the day. I have yet to see any of them have any kind of osteonecrotic event having done that. So I would suggest if you guys are working with people like this, maybe for about 2 or 3 weeks, you give them some melatonin orally and maybe some melatonin topically to prep them for what you're about to do. This article is entitled Therapeutic Potential of Melatonin in Oral Medicine and Periodontology, and these are looking at methacrylate compounds. So methacrylate compounds present in commonly used dental polymers are known to have cytotoxic effects. Due to antioxidant properties, melatonin has been observed to protect dental pulp cells against DNA damage due to methacrylate. Therefore, melatonin in the form of sublingual tablets, gels, or mouth rinses has the potential to inhibit the genotoxic effects of methacrylate-based dental materials. This is another article that's looking specifically at methacrylate-based dental materials. The authors say methacrylate monomers are released from the restoration into the oral cavity and into the pulp, where they gain access to other tissues and organs. Did not know this, but certainly it stands to reason. Whatever we're putting in the mouth is whatever you put on your skin is likely to be going every place else too. Such monomers have displayed toxic properties in many in vivo and in vitro studies, including cytotoxicity and genotoxicity. And a considerable portion of these effects is underlined by the oxidative action of these compounds. And the authors go on to say, as melatonin shows biocompatibility with the oral cavity and displays antioxidant oxidative properties, it can be considered as a protective agent against harmful effects methacrylate monomers derived from dental restorations. Melatonin decreases cytotoxic and genotoxic effects of methacrylate monomers used in dentistry, and it does not influence the bond strength of the composites themselves. So win-win on that. This opens a new possible application of melatonin to improve properties of biomaterials used in dentistry. So there's a lot of information, as you can imagine, on the use of melatonin in oral cancer as well. This article was one we already looked at, just published last year. And we'll just go through some of the quotes from the article. As the reactive oxygen species are involved in the manifestation of precancerous lesions, such as leukoplakia and lichen planus. Now, I looked up the treatment of leukoplania and lichen planus with melatonin. I couldn't find anything. Doesn't mean it's there, it just means I couldn't find it. But it seems to me that would, I haven't had a chance to try this yet, but that would, if you got a patient that has this, I'd like to hear if you put some topical melatonin on them or gives them some sort of treatment like that. I've tried ozone. Ozone doesn't really work for this. But try, maybe it'll work in the presence of melatonin, or maybe the melatonin all by itself will work. But I think less topical and oral melatonin might be a treatment for lichen planus, which, as I understand, is extremely difficult, not only for me to treat, but for most people. Melatonin plays a preventive or therapeutic role against oral cancer due to its antioxidant properties. Additionally, melatonin prevents damage to healthy tissues due to radiotherapy, which is routinely employed to treat oral cancers. I have quite a few patients that have had squamous cell CAs of the head and neck, and a lot of them right in the throat, right? And so when they get the radiation therapy, as you know, they often lose their saliva excretion. They can lose teeth. They can have, the teeth can get loose. They can have painful teeth. All kinds of problems can happen as collateral damage from the radiation. Melatonin is a very potent, is such a potent free radical scavenger that it pretty much obviates most radiation damage. So if you're having a patient that's getting radiation for any purpose, anywhere, it could be prostate for that matter, high doses of melatonin during the radiation process does not interfere with it. I have at least 3 patients now with squamous cell carcinoma that have been successfully treated with radiation, and temporarily, they lost the saliva. It all came back in all 3 people, and none of them lost any teeth. None of them really had any problems. And that was just from systemic melatonin. I didn't use it orally. Additionally, melatonin prevents damage to healthy tissues. Well, I just read that. Okay. A recent in vitro study suggests that melatonin may impede metastasis of oral cancer by inhibiting metalloproteinase 9 activation, which is one of the mechanisms by which cells can metastasize. Therefore, oral rinses, gels, and toothpaste containing melatonin could be beneficial for impeding and preventing oral cancer. Okay, melatonin is an antimicrobial agent. We've already seen this article. They go on to discuss the importance of it with respect to some of the infections that we see. Melatonin does present antimicrobial properties against a variety of bacteria and viruses. Well, oh yeah, one of the things I didn't mention to you is that Reiter has published studies on is that in animal studies, if you take a bunch of old animals and divide them into 2 groups, one group you expose to viruses, the other group you expose to viruses, plus you pre-treat them with melatonin, these guys don't get sick. So I think there's a lot of advantages to us as we're getting older. Instead of getting flu vaccines and the rest of that stuff, just take some good heavy dose of melatonin every day. Okay, so however, to the author's best knowledge, no studies have been conducted testing the effects of melatonin against some of the karyogenic bacteria, such as staph mutans and lactobacillus. Nevertheless, in 1976, a study by Mention and Torrey reported significantly reduced caries in rats receiving intraperitoneal injections of melatonin compared with those who did not get the melatonin treatment. The direct antimicrobial action of melatonin, synergistically supported by immunomodulatory and antioxidant properties, for example, ozone therapy, may prove to be a potent weapon against numerous oral infections. And so that actually, I think, is the end of, that's the end of my presentation. So I want to leave some time for any questions about melatonin, because it's an absolutely fascinating topic, and we could go on and on with this one for a long time. But yeah, Charlie?
If the melatonin decreases osteoplastic activity, has anyone tested it in osteoporosis or osteopenia?
Yes, yeah. So the question was, what about other examples of bone loss, like osteoporosis? Yeah, very definitely. Melatonin has been shown to, in some animal studies, has been shown to, what is it, the rats, They've taken rats, they've given them, aged rats, by the way. It's got nothing to do with the U.S. Congress. These are Worcester rats, just in case you get confused. And they took aged Worcester rats and gave half of them oral melatonin, and the other half didn't get it, and they lived out their lives. And then they, at autopsy, they tested bone strength, they tested osteoblast activity, they tested osteoclastic activity. Oh yeah, they looked at cortical thickness, they looked at trabecular bone thickness, and they were all much, much better in the melatonin-treated group. And we have some human studies also that verify it for osteoporosis. So once again, you can't hardly go wrong if you're over 50 taking a pretty hefty dose of melatonin. Yeah, what sort of doses? Well, okay, my cancer patients, I give 60 milligrams 4 times a day. Breakfast, lunch, dinner, before bed. 60 milligrams. I've done this with maybe 60 people. I've had one person say she got sleepy during the day, I had to stop it. And she was like 92, so that might have had something to do with it. I've had, I think, one other person tell me that they were drowsy a little bit. And I had to play around with it a little bit, but that's it. It's really quite unusual to see melatonin cause these side effects that you hear about. So your patients will tell you, I've taken melatonin before, I take it at night, I'm drowsy in the morning, I get all these crazy side effects during sleep, and since I've been using just pure melatonin, without any incipients that's not been tableted, because you have to get the pure thing. That's what Ryder taught me. You have to get the pure one. If it's got any incipients in it, if it's been subjected to heat, it's a delicate molecule, and you'll wreck it, and then you'll get these side effects. So if you do that, if you get really pure stuff, you will not have a problem in most of the time. Even with the pure stuff, a few people tell me, I got to reduce the dose. Yeah. Say again? Yeah, well, one way to get it is at purebulk.com, P-U-R-E, bulk, B-U-L-K.com. I have no interest in that outfit, and they're very interesting, by the way. They can get all kinds of stuff for pretty inexpensive at Pure Bulk. Another one, you can get the capsules made. I had a company make me up pure capsules called Melatonin Max. They're 60 milligram capsules. So you either take the powder, throw it in your mouth, or get the Melatonin Max, which you get at perfectvitaminproducts.com. And the capsules make it easier. They're a little bit more expensive, but they're easier to take. Yes? Did you hear her? Okay, negative feedback inhibition. Spoken like a true endocrinologist. Simple answer, there is none. This has been proven. We know this. There's no negative feedback induction from melatonin. You can take as much as you want. Your body will still make it. You make melatonin at night. And one parting little word I'll give you guys, because it's my time to move on here. One parting little word I'll give you guys, and that is, in your bedroom, it should be dark. So dark that you can't see your hand right here. If you got ambient light coming in, if you have night lights on, anything like that, that's going to interfere with your production of melatonin at night and place you in some jeopardy for all this stuff we've been talking about. Red light won't do it. So if your alarm clock has red light, fine. But if it's got green light, put a pillow over it. If you have night lights, they're fine. As long as they're red, they're fine. You won't kill yourself going to the bathroom. But no green, no white, no blue, none of the other colors. Red light's perfectly okay. And interestingly enough, full moonlight is perfectly fine. So thanks very much, you guys, and I'll see you at the question and answers.